Welcome to a presentation on advanced practices for the pharmacy technician, focusing on the Tech program. My name is Arlene Wright. I graduated from Drake University in 1981. I am the pharmacy manager at Covenant Medical Center and have been at this institution for almost 25 years. I am in charge of daily operations and implementing new pharmacy programs at our facility. Dr. John Hamill is the Regional Director of Pharmacy for the Wheaton Franciscan Healthcare Facilities in Iowa. He graduated from the University of Iowa in 1997, where he also served as a member of ROCI, the College of Pharmacy's Curriculum Planning Committee, and was an inaugural member of Dr. Henry Manasseh's PSAP program to encourage cooperation between the students of the various colleges of healthcare. He has also served as a member of ISMP's nationwide forum on ADU safe practices. Neither John nor I have any conflicts of interest in relationship to this presentation. Let's begin with goals and objectives. The goal of this program is to introduce you to the concept of a Tech program and identify elements required for a program. After participating in this program, you will be able to differentiate between traditional technician roles and those allowed by a Tech program. List the advantages of a Tech program, describe what's required for a Tech program, and identify how research supports the accuracy of a TCT program compared to a pharmacist final check. Traditional technician roles consist of non-judgmental or technical functions. Throughout the United States, legally, a pharmacist must perform the final check on all medications prior to leaving the pharmacy, and technicians are not allowed to provide patient counseling or clinical functions. So what can technicians do? Technicians play a vital role in providing health care. I will focus on two common areas where technicians are employed: the outpatient retail setting or the inpatient hospital settings. One of the primary duties performed in the retail setting is counting tablets for prescription preparation. This can be done using a counting tray, where tablets are manually counted by sets of 5, or, as technology has advanced, many pharmacies now use electronic pill counters that not only count the tablets, but include tablet identification to verify correct medication at time of prescription preparation. This definitely increases patient safety. Other duties performed by technicians include stocking shelves, placing orders, answering phones, and billing insurance companies. Most of you are aware of what a retail setting looks like, but may not be familiar with the hospital. In contrast to the retail setting, where many tablets are dispensed at a time to one patient, the hospital uses a technique called unit dose. This is where tablets are individually packaged to be taken to the patient at the time of the medication pass or when the medication is scheduled to be given. Individual doses of ordered medications are placed in patient-specific bins on the nursing unit and are usually refilled every 24 hours. Alternatively, if technology is available, these individual medications are stored in an automated dispensing machine where individual doses are dispensed based on what is specifically ordered for the patient. The nurse removes each dose right before it will be administered to the patient. This technique promotes patient safety and prevents waste, as medication orders change frequently in the hospital setting. The hospital technician will refill patient medication bins and/or the automated dispensing machines, perform billing tasks, check for outdates, compound IVs, and many of these duties are site-specific. Now that you have an idea of the traditional technician duties, let's move forward to what is different about a Tech program. A Tech Check Tech program allows authorized technicians to perform the final check of another technician based on their site-specific policy. In order to do this, there are a few things in general that states require to allow TCT programs. The pharmacy technician must have specialized and advanced specific training. They are allowed to refill medication storage areas, cart fill, barcode IV preparation, kit verification, retail prescription refills, and automated robotic prescription filling machines. There must be quality assurance measures in place and monitored. Take a moment to think about why a Tech Check Tech program would be beneficial. Here are the reasons I feel a Tech Check Tech program is beneficial, and there are several. Studies have shown that technician checking is as accurate as a pharmacist's, if not more, which delivers better patient safety. It provides an opportunity for technician career growth and recognition for excellent performance. Also, professional pride and personal gratification. There has been a documented increase in pharmacy productivity for both the technicians and pharmacists, as the techs are not waiting for the pharmacist's check and the pharmacists are not interrupted to check something. Interruptions are known to be one of the primary reasons for medication errors. From the pharmacist's perspective as well, they can expand on direct patient care activities. I have highlighted only 3 of many studies in chronological order that support technician accuracy. The first is from 1991, where both the pharmacists and technicians identified medication errors in a unit dose system. The techs performed statistically better than the pharmacist at a rate of 97% compared to the pharmacist's rate of 94.3%. The second study was done in 2002. Again, pharmacists and technicians checked unit dose cassettes for medication errors, and the techs again performed better. There is definitely data to support that technicians are better than pharmacists at checking cassettes, but there is still the question of whether accuracy can be maintained after time. This study also looked at data to answer that question, and the follow-up studies showed that technician accuracy was maintained at 99.8%. And the final study is a more recent one where the techs and pharmacists resulted equally accurate. Nationally, 17 states, those designated in blue, have board-recognized Tech Check Tech programs. The orange-colored states have reported pilot or innovative programs for technicians. Most boards of pharmacy include the following components in an improved Tech Check Tech program. Some are restricted to institutional settings. There needs to be an independent verification of the medication by a licensed individual, such as a physician, nurse, paramedic, or respiratory therapist, prior to medication administration. The technician must have experience, often months up to a couple of years. There is specific training. Quality improvement evaluation is associated with the program. Existing clinical pharmacy programs are enhanced or new programs added. And the pharmacist in charge continues to be responsible for the program oversight. So what does training include? There are 3 components. There's a written aspect. You will need to know medication and dosing forms. You'll be able to do math to calculate volume of medications or number of tablets for the dose. You need to have site process knowledge to prevent errors and be efficient. And you and the pharmacist will need to participate in quality improvement studies or evaluations. The next component is a practical exam. This is where errors are specifically introduced into the unit dose system being checked for the applicant to identify. Usually there are a certain number of errors introduced per number of doses checked to obtain an accuracy percentage. The final step is validation. This is the process where a pharmacist spot checks continued accuracy. Let's move on to a specific TCT program. Up until now, I have been talking about TCT programs in general. Now, I would like to focus on the program at the facility I practice at. Covenant Medical Center is a 366 licensed bed hospital in Waterloo, Iowa, which is in the northeast corner of the state. It is affiliated with two smaller hospitals, Sartori in Cedar Falls and Mercy in Owine, which is a critical access hospital, and there are 3 area retail sites. When our program was presented to the Iowa Board of Pharmacy, we promoted the program based on facts that our departmental environment promotes an atmosphere where technicians and pharmacists feel free to ask questions of each other in a non-threatening manner. A pharmacist is readily available for questions and is directly responsible. Development of a technician career ladder to improve retention and job satisfaction will be created. Barcode technology is employed in the pharmacy and on the nursing units for increased patient safety. An estimated 4 to 6 hours daily of pharmacist time would be freed up to enhance clinical services. The program was approved and implemented in March of 2012 and was the second program in the state of Iowa. At the last Joint Commission survey a couple of years ago, they accepted our policy and procedures as a national best practice, and for any of you who are familiar with Joint Commission regulations, that is quite an honor. This concept was presented at the 2013 Iowa Pharmacists Association annual meeting poster session and won the IPA Foundation Award for an original and innovative research project that advances the practice of pharmacy in Iowa. Getting back to the components of our program, a physician, nurse, paramedic, or respiratory therapist, or other licensed healthcare provider must review the med prior to administration. When barcode technology is used to pull and administer the medication, that provides an additional patient safety feature. In order for technicians to be eligible for this status, they must be a certified technician, have 1 year experience, and a positive annual performance evaluation. Reading and written exams are required on what the TCT program allows, quality assurance, packaging, selection and identification of the medication, math calculations, abbreviations, medication errors, and the site-specific policy. The practical portion includes air introduction into 5 audits, each of 1,000 doses at 100% accuracy for the Pyxis fill. So that's a total of 5,000 doses over several weeks that must be 100% accurate. Covenant also fills many ambulance kits and kits for use in procedures, such as labor and delivery and for intubation. 5 checks of each type of kit must be done at 100%. For validation, initially every 2 weeks a pharmacist performs a check and the results need to be at or above 99.5%. When accuracy is consistently above 99.5%, the frequency may be reduced to monthly. If the accuracy falls below that, re-education will be conducted and the practical portion repeated. During the day, any variances to accuracy are documented on a clipboard and reviewed the next day at our safety huddle. Twice a year, a specific PDSA quality improvement project needs to be performed. A couple of the improvements made include reviewing the med ID on the PIC label with the shelf location when pulling the first dose, and putting extended release products in longer boxes on the shelf. The next slide shows the continued accuracy of the program. Our baseline was 99.5% and has steadily climbed each year to now where we are at 99.99% accuracy. To note that the accuracy needs to be the same or above the baseline number, or the program requires re-evaluation and retraining. With numbers like this, we feel like patient safety is definitely at the forefront using the TCT program. I would like to highlight different perspectives of our TCT program, and they are all positive. The techs like the expanded skills and responsibilities, and of course the pay increase associated with the additional responsibilities. The pharmacists have more time to perform clinical skills and fewer interruptions during the order entry process. Management notices efficiency for both techs and pharmacists and increased teamwork and respect within the department. The program at Covenant has been successful for several years and recently expanded to Sartori Hospital and will be implemented at one of the retail stores as well. What does the future hold for pharmacy technicians? National organizations have adopted statements and embraced the idea to advance the role of pharmacy technicians. The Pharmacy Practice Model Initiative in November of 2010 looks to advance the health and well-being of patients using optimal pharmacy practice models. One of the objectives talks about actions pharmacy leaders should take to implement practice model change, including advancing the use of pharmacy technicians. The American Society of Health System Pharmacists 2020 Vision Statement will require technicians to be credentialed for complex and high-risk services. The American Pharmacists Association also recognized that pharmacy technician responsibilities have been increasing and will continue to do so as pharmacists transition to providing more clinical care. I have included email addresses for John and me. If you have any questions, feel free to contact either of us. Here are the references for additional information on this topic. In closing, I hope each of you is fortunate enough to experience an exciting career in an ever-changing profession that will allow you to work at your full potential. Thank you.